So I think we're going to get started right away, just in terms of intros, just to be acknowledging that this is probably going to be a great conversation. We want to get right into it, but respecting that probably we'll have a few people join us. So if you're not muted, please go mute yourself. Awesome. And just welcome to our webinar series, Health and Equity Making Systems Accountable. If this is the first time you're joining us for this series, welcome. My name is Erin Wolfson, and I'm the Community Engagement Specialist in the College of Medicine at the University of Saskatchewan. And I'm really happy to be here co-hosting this webinar this afternoon with the Saskatoon Poverty Reduction Partnership, which we'll hear more about in a minute. And just really grateful that you decided to join us for this important conversation around public washrooms. Today is December 10th, and I don't know much about, but we do know that it's internationally, globally observed as Human Rights Day. And it's just important to kind of acknowledge the human rights approach to health and wellness, which is so critical to addressing the growing health inequities, not just globally, but here at home. So wherever you're joining us from, I just want to offer you a really warm welcome here. And these monthly webinars are part of our way in the Division of Social Accountability of gathering our community to have ongoing and timely conversations about equity and accountability so that we can continue to advance our knowledge, learning, and practice in this work. So most of you, I assume, are not your first time on Zoom. So if you can go into the chat box and let us know where you're coming from, it's just really great to know who is here with us. So I'll let you do that while I continue just giving a few logistical pieces. As always, you have the option of turning your video on and off, but we do love to see your face, and it just really does help to build community and connection. So if you're able to do that, we'd appreciate it. And just want to acknowledge and appreciate the technology that allows us to connect in this way. You should be muted, and if for some reason you're not, please do make sure you're muted just to reduce feedback. And I really want to make sure we begin today's webinar by acknowledging and grounding us in the recognition that we are meeting on Indigenous land. And the Division of Social Accountability is located in Saskatoon on Treaty 6 territory in the homeland of the Métis. And as a white settler and guest living on this land, I'm just very grateful for the opportunity to meet on this land and the traditional homeland of many Indigenous peoples. And as treaty people, we know that we have some responsibilities and that we are accountable to these responsibilities. So I like to, as I often do with these webinars, just want to take a moment for everyone to take a pause, and that wherever you are joining us from, recognizing that not everybody's here in the same land, to acknowledge, do your own silent acknowledgement of the land. And in this moment of pause for these conversations, just to invite you to connect in with what brought you here, and just to ground into why you are here and why it is important for you to be here. And often, these are busy times and sometimes difficult times to take that moment to really reconnect to our bodies, to why we're here, and just to really taking a moment to arrive in this space. So if it resonates with you, just to invite you to take a few breaths on your own time. Maybe just slowing down a bit your exhale and just really feeling sort of your feet on the floor, maybe the weight and support of your chair. As we, just check in and notice how we're doing and again, what brought us here. And as we notice how we're showing up, just acknowledging that these conversations may have different impacts so that we show up in the way that we need to. All right, so with all that being said, I just want to offer a warm welcome to this space and to this conversation, and just really offering my gratitude and appreciation for being here. Okay, so without further ado, I'm going to introduce our co-host for this webinar. And if you've been following this series for a while, then you will be very familiar with Colleen Christopherson-Cote, who is the coordinator of the Saskatoon Poverty Reduction Partnership, or SPRP. And very briefly, I'll just share a little bit about Colleen if you don't know who she is. Colleen is a community development consultant with more than 20 years of experience and specializes in collective impact in human services policy and practice. And over the last 9 years, she has lived in Saskatoon, working in many roles, including the SPRP, co-coordinator of the Safe Community Action Alliance, director of evaluation of the Saskatoon Housing Initiative Partnerships, coordinator of the Saskatoon Early Years Partnership, to name a few. And most recently, she's had the opportunity to work as the incident command for the Saskatoon Interagency Response to COVID-19, a community collective action project that supports the agencies who provide services to many of the most vulnerable Saskatoon residents. So we're just so grateful, Colleen, that you're, these partnerships and working together has been wonderful. And I just want to offer a warm welcome to you. I'll pass it over to you.
Thanks, Erin. This is actually a collaborative of SPRP. So it's a collaborative upon a collaborative upon a collaborative that grew out of a conversation with interagency response. So it's quite interesting the way that collective impact models grow and the energy drives them in certain pathways. And so we are always grateful to have the relationship with DSA to host these lunch and learns and to share some of the work and then to connect people to some of the passions and other work that's going on in the community. So I'm gonna be sort of co-speaking today with Kayla from Prairie Harm. She'll do a little bit of an intro about herself as well. We encourage people to drop questions into the chat. There will be some time in this conversation for dialogue and questions at the end, we hope. And then there will also be some other folks joining from the advisory team, some from the city, and there are other advisory team members on the call. So if there are things that you want to add to the discussion, we certainly would encourage you to flag and unmute and share that information. So let's see if my tech is going to work. Did it switch? Yes, did it switch? Kayla, you're up. So let's welcome Kayla. Many of you know her from Prairie Harm, and I think Kayla, you can just do your own intro. Is that okay?
Yes. First, Erin did such a beautiful job welcoming us to our Treaty 6 territory in the homeland of the Métis. And of course, we want to acknowledge that the work that we're doing and the presenters that are here with us today are talking about programs and services and people that also live in Treaty 6 territory and the homeland of the Métis, and that we work to respect these ancestors and cherish our relationship with one another as we work together as a collaborative group of community partners from across all sectors, demographics, experiences to build a stronger, more equitable community. So my name is Kayla Dumong. I am the Associate Director for Prairie Harm Reduction here in Saskatoon. And we have a couple folks from the City of Saskatoon. If you want to just take a second to introduce yourself. And Troy, I think I saw you. I'm not sure if Dan is here yet or not. Did we lose Troy?
Let's try that.
I'm dancing around. I'm here. I can hear Troy talking, but I think he's mute right now. So.
So Troy and Dan are here together from the City of Saskatoon.
That's right.
And so this is our agenda for the day, just to go through some information. Lots of the sides say lots of the words. We're not going to say all the things that are on them, but are more so that you guys can read the information and see where this work started, where we are, and where we are going.
And so Kayla and I are going to flip back and forth, and then there'll be times when Troy and Dan will pop in. And like I said, there's some other partners as well from the advisory team on the call. So I would also welcome them to join in whenever they feel so inclined. And so just a little brief background around what is the advisory team. And I'm going to give you some history as how it came to be. But this project currently is co-led by me at the SPRP and the City of Saskatoon. There are multiple City of Saskatoon departments involved because the City of Saskatoon is a mega beast as far as the system goes, and there are lots of moving pieces. And so all those folks who are connected to all that work inside the city have to be part of the conversation. But also there are community partners that tied to this as well. So the Food Bank and Learning Center, Prairie Harm, Quint, St. Paul's Hospital's involved. health authority in general is involved, the public library, also the interagency response, because this was born from a conversation at that table, and then Station 20 West is represented as well. As the work emerges and we talk about our goals moving forward, there will be plenty of opportunity. So if you're on the call and you're like, I love public washroom advocacy, there will be lots of opportunity for you to get engaged in the work moving forward as we sort of introduce what the goals are of the work. And so there will be, like I said, a couple of us speaking throughout the presentation. So why did public washrooms become an issue for the Poverty Reduction Partnership, and more importantly, the interagency response? And as we were working through the COVID response, we realized that within the first 100-ish days, if we can think back to March of 2020, when things we didn't really know what to expect from COVID, and we were really pretty naive, right? Like, do you think it's going to be a thing? Do you think it's going to impact us? Do you think things are going to close? And then all of a sudden things started closing. And what happened in that time period was, what we realized is that we went 117 days in Saskatoon without any access to public washrooms. And there's a process in place when you're in an emergency response that we learned very quickly in community through the guidance and supports of the EMO, the Emergency Management Operations folks. And they have a form document called a 401. And so we escalated this issue to the EMO and to the city, and that struck a committee off the get-go to start talking about planning. At the same time that was happening and we were identifying gaps inside the interagency response, we were lucky enough to get 4 Making the Link students. And so that's a College of Medicine. They're like med students, second-year med students. And so we had 4 of them working on key projects. And we just happened to have one of the students really quite interested in public washrooms. And so GIFT created a document that sort of set the groundwork for us to build this work. And so he, in that relationship, in the early part of 2020, built a relationship with Edmonton. We started looking around, like, what are other urban centers doing? Are they also without washrooms? You'll remember too, if you think back and if you Google search sort of the media around public washrooms in the summer of 2020, Regina had flagged that they were having issues with defecation in parks, and we could start seeing that problem emerging in urban centers across the province. And so we've tried to figure out what would be the quickest, most reasonable way to get washrooms open. And at the same time that we were sort of flagging this, the reopen strategy was sort of on the doorstep, since we were talking with places like the malls and other businesses that we knew would have potential conflicts and or needs and higher demand use because other washrooms were closed. In the report from GIFT in the early, I guess it was the end part of the summer of 2020, she clearly outlined some things that we should do. And so the first piece of that was advocacy with the city to take an active lead, because this is a basic human right. And that we needed to increase the access to the number of city operated washrooms. Now that's a complicated thing, and you're going to hear from the city folks around what those complications are. It's easy for us to high level look down and say, these are the things that need to do. And then you start getting into the moving pieces and it becomes quite complicated. And so this was designed to be a really high level appreciation of what could or make change, what we should be doing to make changes. And then we looked at other really great urban models, and they all have a connection to attendance and monitoring for safety, for access and navigation to systems, those kind of things. And so we thought, you know, what could a social enterprise look like? What would that, how could that be funded? And then how do we talk about innovative funding ideas so that we don't actually need to build more washrooms? What we actually need to do is figure out where the washrooms are and how to better utilize them. And then increase awareness around, you know, why public washrooms is an important piece. And so the big sort of drawing thing around this report from GIFT and the work in the early part of 2020 was that access to sanitation was declared a basic human right by the United Nations in 2015. And so, in fact, not providing access to washrooms in Saskatoon is a violation of a universal basic human right. And so that in itself should urge us to try to figure out the best course of action moving forward so that people have a 24/7, 365 model of some kind that is safe and appropriate and accessible for them. That leads us to the city. So early on in this conversation, the city committed some money and said, okay, so try to figure out a pilot project that could address some of the issues that GIFT had identified. And so I'm going to turn it over to Troy and Dan to talk a little bit about, like, what does the city infrastructure look like? We didn't really even know what were the best opportunities, what could we do to open stuff. We're still talking about warm weather at this point, early in the 2020 scheme, and then what happens as winter starts to set in.
All right, thank you, Colleen. And I'll get us started. My name is Troy Lefevre. I'm the Director for Facilities Management, City of Saskatoon. Dan Srahone, he's a facility manager. He's been directly involved with this committee for quite a while. So I'll get us started, and maybe I'll pass it off to Dan for any more details as they come up. So the facilities management team for Saskatoon, we take care of all the buildings across the city, but included in that is the washrooms, public washrooms throughout the entire community. And so that includes approximately about 14 washroom locations across the city. 6 of them are permanent washrooms, that's all year round, and the remainder, about 8 of them are seasonal washrooms located mostly in our parks. And these are, the more permanent are along our riverbank. I think there's 6 of them, like I stated. And so what we do is we make sure they're operating correctly. We maintain them on a daily basis. We open and close them with the opening hours that are depending on the sim, but generally 8 a.m. in the morning till 10 p.m. in the evening in the summer, and then 8 a.m. till 8 p.m. in the winter. And that's been set up over time as the best operating hours that we've through the advocacy groups, and that's what we've determined to work best. We also, for some of them, the more highly used washrooms along the riverbank, we have regular inspections on them, approximately 3 times a day inside those opening hours. So our teams go out there, we regularly inspect them, we maintain them, that's the clean of them, as well as repairing any damage that it would ever occur in them, and so forth. I don't know, Dan, do you have anything else you'd like to add to that?
Sure. I mean, thanks, Colleen, for introducing us. You're correct. We went to, when COVID hit in 2020, there was a lot of sort of running without knowing what we were doing. This is a good way to put it. And what was determined by our emergency response group was that we would close down all the public washrooms, and that was happening in restaurants, and couldn't go to Tim Hortons, couldn't go inside, couldn't go to any place and get it, and public drinking fountains and all of that stuff was closed, and so we closed it. And then when the group came to council and to us and said, there's people living out there that they don't have access to anything, we went back to revisited that decision and decided to open the public washrooms. And we run into issues in the washrooms that we try and mitigate, but we people camping out in the washrooms, we have damage, it's vandalism's done in the washrooms. And we've tried various things over the last couple of years to some of them were a little harsh. If we had vandalism in the washroom, we would shut it for 2 days, and I'd just say, and we sit and clean it up and then open it. And that wasn't working. That was too harsh, I believe, but it was decision made. And so now we have commissioners that visit the problematic washrooms 3 or 4 times a day. They try and move people along. They report to our cleaning staff and or maintenance staff if there's issues in the washrooms, and we do best to try and keep the washrooms open. We close them when they're inoperable or unusable because of whatever condition they're in, but we try and get them up and running as quickly as possible. And so that's kind of where we are right now. Is we adjust the opening hours to try and mitigate the congregation in the washrooms, and we have the commissioners checking the downtown washrooms, and we do our best to keep them open as much as possible. But there are times when they're basically unusable after some of the stuff that's done in there. So that's where we are right now.
Thanks so much for that. I think I'm just going to click on this link. This is all techie stuff, right? I don't know. Sometimes the tech works and sometimes it doesn't. But one of the things that we set off to do in the very beginning was like looking at a mapping option around where the washrooms are. And we're still collecting a bunch of this data, because you're going to hear later on that this isn't just about, first of all, there's zero judgment in the way we responded to COVID in March of 2020, because none of us knew what we were supposed to do. So closing the washrooms was smart on Tuesday and not smart on Wednesday. And that's just the way things were. And what's happened now is that the relationship with the city is so strong that we're trying to figure out the most reasonable way to figure out the best use of the current washroom systems. And so we thought we would map things. So I'm going to show you, hopefully, that we're building this sort of interactive map. And so we can zoom in. We've labeled them. Some of them are the city infrastructure that you just heard about. Some of them are businesses that we know are willing to let their washrooms be open. Some of them are community centers or community agencies, things like Station 20 West or Prairie Harm has a drop-in center. Those kind of things are getting on the map. And so what we're trying to do is figure out where they all are, so that when we talk about our long-term plan, we can actually have an interactive washroom map so that people know where they can get access to it. So it's a work in progress. I think the other thing that we did, and I don't know whether Kayla or anyone else wants to jump in, was take a really deep look. And we have a student right now from social work who's working on a bit of a case study for us to look really deeply at Edmonton and Winnipeg, because they're kind of like our sister urban centers, right? We share a lot of similarities in demographics and need, not necessarily in funding, but that's a different conversation for an entirely different webinar. And so, what's going on out there for public washrooms? How are they managing in those urban centers? Both of them have staffing attached to these washrooms, and you'll see media over the course of the last handful of months from both cities speaking to some of the problems that were flagged by the city around sort of misuse and also some myths around what people are using the public washrooms for. And we're going to get into that in a second. Kayla and I are kind of sort of unpack why we're focusing on a 24/7, 365 model and what that's going to look like. But you can Google search and take a look. Many of them have really innovative structures. Some of them self-clean, some of them have staff, but most big urban centers have municipally managed 24/7-ish public washroom structures. And so Edmonton's closes for a couple of hours every night, later in the night, for cleaning and sort of restocking. And some of them never close because they self-clean, and they're accessible single-use kind of washrooms that are popping up all over sort of different neighborhoods. And so what we're doing is trying to take a look at what other urban centers are doing well, and then see what would work for the City of Saskatoon. All right. This leads us to what was going on in the summer of 2021, because I think in the summer of 2021, we thought maybe COVID would be done. Unfortunately, not so much. So I'll let Kayla talk a little bit about what triggered the reactivation, essentially, of the advisory team.
So the need for public washrooms isn't just a standalone issue. It ties into the continuing increase of homelessness in our community, and specifically the issues that we are seeing in Pleasant Hill area. So the pictures that are here are actually behind Prairie Harm's building, and these were taken in July. We have a drop-in center that, thanks to donations, is now open Monday to Friday, 10 a.m. to 10:30. We, up until very recently, had to close down at 4 p.m. every day. And we were and still are the only truly fully accessible public washroom in the Pleasant Hill area that people are able to access without restrictions. Prior to COVID, St. Paul's public washrooms were quite frequently used, and some other agencies in the area, but COVID restrictions have definitely limited what those places are able to do. And so in the summer of 2021, after a year of kind of dealing with people creating encampments behind our building, and living behind our building in the alley behind our building on 20th Street is quite active, it has become more and more of an issue with staff having to clean up human feces and urine all over the property, discarded menstrual supplies, all of that sort of thing, because there is no access to the public washrooms for most of the day. And so in and around our building, we did a quick survey in July to kind of look at what we are looking at for homelessness in and around just people accessing prey harm reduction. And in a 3-day period, we identified 150 people. And the increase, COVID, the SIS program changes with income assistance and the new income assistance program, the closure of City Center Inn and Suites last summer, the closure of Prairie Heights Tower on 20th Street. All these things have made a big impact on people's ability to be housed.
Do you want me to switch the slide now?
Yeah.
Sorry, the pause. Maybe. There we go.
So public washrooms are something we tend to take really for granted, and it was definitely not something that I ever imagined being part of my job. And when I tell people that I spend a lot of time talking about public washrooms, it's often seen as quite an odd thing to do in my line of work. But it is something that truly impacts everyone. And for prey harm reduction and a lot of the work that we're talking about, the people that we're talking about are our city's most vulnerable folks and our citizens that are sleeping rough, who are experiencing high levels of transiency and absolute homelessness. But it really does affect everyone. I have an outreach team that runs all over this city, and not having access to washrooms is a big issue for them when they're out in the van for 8 hours a shift. And it's a quality of life issue. There's a lot of dignity being compromised with people when they're having to go outside and having to use alleyways and hide around corners to use washrooms.
Yeah, I'd like just add that, so why is Poverty Reduction Partnership involved in public washrooms too? You'd think that'd be a kind of a weird thing for us to talk about, like why are public washrooms a poverty reduction strategy? Because like many social determinants of health related things, people who live in poverty are disproportionately impacted by these things. And so there are privileges that come with affluence and wealth that folks who don't have that can simply go to the beds and use the washroom in the lobby without a fair amount of hardship. And then during COVID, that wasn't an option even for privilege and affluence, right? But as we sort of emerge out of COVID and realize that folks who are living in poverty don't have the same access as folks that aren't living in poverty. And so that's the equity piece, and also one of the reasons why we're talking about it on today, the National Day for Human Rights.
So everyone uses bathrooms, right? Like it's an everybody issue. And it's something that everybody should have equitable access to. And along with just having the facilities to use the washroom, something that really we found is a very important part of the conversation is making sure that people who menstruate have equitable access to facilities for hygiene reasons, and they have equitable access to the supplies they need.
One of the other things in the report, particularly from GIFT, was that folks who have health-related issues who require a space to seek access to either wash whatever or use needles for insulin or other things related to health, when they don't have access to a public washroom, then they simply just don't go out and about. And so it creates this sort of health-related inequity and decreases sort of in community engagement for folks. We wanted to talk a little bit about myths, and Kayla is so like, so she's just so brilliant about talking about the myths, right? And so we hear about misuse, and sometimes that triggers us to talk a bit more fiercely about what equity is about.
Mm-hmm. And so a lot of, when it comes to myths and assumptions that people make, so often they're made based on the fact that we take so many day-to-day things for granted. And for many of our folks, making sure that there is access to safe water and sanitation comes with the ability to meet a lot of other needs. For prairie harm reduction, having access to our drop-in space and our support staff is really important, in addition to our public washroom space. Having privacy, and again, that dignity to manage your own health needs and sanitation needs, being able to wash clean clothing. We have, a lot of sink bathers, and we don't often think about those things when we think about access to safe and available sanitation. A place where sharps can be disposed of properly, where substance use does happen and needs to be a real part of the conversation. A place to breastfeed, change diapers, support children, and for many people in our community, a place to sleep. And again, that all ties into our increased numbers of homelessness and transiency that we are seeing. And something that we often feel uncomfortable talking about is that this isn't just individuals. This is absolutely families and children that are affected by these things as well.
So the committee is advocating for this thing, a 24/7, 365 public washroom model. I think when you hear that term, a lot of people think, well, that means that, Troy and Dan better figure out how to keep a public washroom open 24 hours a day, 7 days a week, 365 days a year. And that's not what we're actually saying. What we're saying is that there is a lot of infrastructure in Saskatoon, and that as a collective, we have an obligation to provide access to these things to the general population in Saskatoon. And so, yes, the city clearly plays a critical role in providing public washroom space and is currently providing public washroom space. What we can do then is talk about how to increase the capacity from the city if possible, but also look at gaps, and then who in those gaps or where in those gaps there might be washroom infrastructure that we could utilize. And so the city of Edmonton did this as well. They looked really closely at White Ave and said, so where are the toilets? And where are the people who are needing the toilets coming from and going to? And often it involves sort of nightclubs or bars or other businesses that have long hours. And so they opened a conversation with those businesses and said, what would it look like if we supported the use of your washroom? Because it's cheaper in the grand scheme of like big government budgets to think about supporting existing infrastructure than it is to build brand new structures and manage them individually. And so what we're talking about is creating a series of short-term, medium-term, and long-term goals that looks at a collective group of washrooms that would then provide, as that collective, a 24/7, 365 model. Some of that might mean a center is open 24 hours, but we actually have to talk about that as a community. So we always talk about Prairie Harm because it's open till 10:30 at night. And it's uniquely situated at 20th and P, which is a high need area that's been identified by the team, right? And so what would it look like if we could open that washroom up past 10:30 and it was 24 hours? It's not as easy as saying to Kayla, we'll just open the doors, hope for the best, right? Like this is about, safely staffing it for the staff and for Prairie Harm, but also for the folks who need to use and get access to the services and supports. And it might be cheaper in the long run to support that kind of opening than it would be to say to Troy and Dan, hey, build a freestanding washroom on the corner of Avenue P and 20th. And the city manages it and staffs it and cleans it and makes sure that it's 24/7. Or maybe the city infrastructure is a good answer. And so what we're trying to do right now is figure out what are all the options, work through advocacy in the community so that people understand why public washrooms is such a critical piece of infrastructure. It's quite interesting. We've been talking, Kayla and I talk about toilets pretty much everywhere we go these days. And we quite often are met with, oh, I never really actually thought about that. Because for me, with privilege, I can get in my car and quickly drive home if that's the case, or I can find somewhere that I might be able to go. But for a lot of folks, that's not an option. And for some folks, they just don't leave home because they don't know where they can go to the washroom. And it could be a medical related thing, or just an anxiety related thing, or a mental health thing, or whatever it is, right? So we really want to try to figure out how to best utilize the current infrastructure. And then if there are gaps, who is best situated to fill that gap. I'm not going to read all the goals. You can see the slide deck if you want. You can also download it. We can give you the links to all that. But basically, there are some emergency things, just like any human service response. There's immediacy, and we've talked about, a short-term goal of a pop-up washroom, particularly in the summer months. That becomes much more complicated in the winter. And how is it staffed? How is it managed? How do we make sure that the space around and inside the washroom is safe, both for the users of the washrooms and for the people who may be coming and going, staff related, etc. Maybe that's supporting a single agency like Prairie Harm or another agency who's willing to open their own washrooms for extended periods of time. We did see over COVID places like Station 20 West open up for extended period of time outside of their normal operating hours. All of this requires resourcing though. Medium-term goals, more to look specifically at relationships of who has what washrooms, and can we advertise and share the access to those washrooms. And we've currently we're going to drop a survey into the link as well near the end. And we're identifying places that are currently open 24 hours and don't have barriers, and what the barriers are. We all know that some places have signs on their door that says, you have to make a purchase to use the washroom. And so we're having conversations around why that is and what we could do to help alleviate some of the pressures to businesses or agencies who are restricting access based on a variety of different internal and legitimate reasons. And then really long-term goals is to take a hard look at the current infrastructure in Saskatoon and where are the new pieces coming. We know there's a new public library coming. We know there's some new capital investments from the city like the bus rapid transit. We also know that other community partners may be building new buildings, and we want to talk to them while they're in the planning stages to say, what would it look like if you built the front end of your building to have accessible washrooms? What would it look like if you had washrooms in the new public library in the atrium? Because if you look at the public library now, the washrooms are not really accessible. And so making sure that that kind of planning in capital infrastructure involves a conversation around a place where people can gather. So if we needed a warm-up space for winter or a cool-down space for summer, and access to washrooms, that would be built in the front end and potentially could have outdoor access that would be cut off from that business or that agency. So if you think the public library, the atrium could have washrooms in it, and then you wouldn't have to go through the library, and the library wouldn't even need to be open to have access to the washrooms, and what that could look like. And then really talking specifically about the intersection between policy and jurisdiction in government around taxation benefits or bylaws, those kind of things that would encourage business to open up their washrooms. When Edmonton has a relationship with some of the businesses where they talk about a tax benefit, and so they get funding from the city to open their washrooms to offset some of the cleaning costs. And some of the perceptions around lost business because you don't have to make a purchase to use the washroom, that kind of stuff. And so those conversations are all ongoing and much longer in scale, I think, than maybe some of our short-term goals, although sometimes I think our short-term goals are actually long-term goals, depending on how things are sort of playing out. Did I miss anything about those? I don't think so. And so we really wanted to leave some space to have a conversation, and you can sort of pick the brains of people from the committee. I guess the long and the short of it for us is that it really is necessary that we have a 24/7, 365 public washroom model in Saskatoon. And as a collective, we need to put our brains together to figure out what is the best way to do that, what's the most efficient use of the current resources, where are the biggest gaps, and how do we fund and resource and collectively work towards filling those gaps so that people have dignity and have access to a basic human right in Saskatoon. Kayla, do you want to add anything else?
No, I think that covers everything.
So we would just sort of open it up to conversation. I'm gonna stop sharing my screen because then I can't see you. Oh, there's so many people. And then I also have we also have a general survey. To go back up to the top because I dropped it in before any of you came somewhere. No, sheesh. Do it this way. So the general survey is designed just to get your thoughts and opinions about public washrooms and a 24/7 model. We also have I hope that worked. We also have an agency specific survey. So if you run an agency or you work at an agency that has access to or has public washrooms in it, and haven't filled out the agency survey, it basically asks you for your hours of operation, if there's barriers or limitations to accessing your washroom. And then what we're trying to do is take all that information and put it on our map so that when we talk about where the current infrastructure is, we have a really good idea which agencies and which washrooms are barrier free, which ones are open and when they're open, so that we can start sharing that information with folks. They're all quiet. Come on, there's got to be some more like cheerleading toilet folks out there because you came on a Friday to talk about toilets, so I know for sure you're all toilet geeks.
Public toilets, even better.
Yeah, public toilets, even better. Yeah.
One of the things I learned from working with this group is the need is pretty site specific. I mean, you have a washroom way up in Silverwood. I mean, that's not really gonna add to the conversation or add to the solution. And so I like some of the discussion we had at previous meetings. We looked at that corridor and we said, well, does the city own any property either because of taxes or other reasons? And there was a few buildings there, that might be accessible. And then also, the thing that I was thinking about is there's a number of religious buildings in that area, and as you said, it's not as simple as just opening the door and say, hey, come in and use the washroom. There's logistics and there's cleaning and security and all that has to go along with that. But I mean, that I think that's a really good approach. Start to look at the existing infrastructure and figure a way to provide that access that's secure, safe, and all the for the building and for the folks using it too. So I like that thought and that approach because yeah, it is fairly site specific. It's got a geographic location that's important in this conversation. So
Yeah, I mean, even we've talked, Dan, about the ones along the river. It's a really long walk from Prairie Harm Reduction to the river to use a washroom. Yeah. Right. And so it's really, while we're not saying we don't need river washrooms, those are all great and we love that infrastructure and it's super important. It's a different set of infrastructure than what we're talking about in that corridor, particularly in and around.
Yeah. Yeah. Not everyone has an SUV to hop in and drive down to the river, right? So, yeah.
And something I think is interesting is that prior to COVID, this wasn't really a conversation that we were having a lot in community. And the need didn't seem as blatantly obvious. We were previously located up on 33rd and had public washroom access. And it was just one of those things we had. There was never a lot of thought or, when we moved into our new building again, we have a public washroom. And prior to the initial shutdown with COVID, there was not a lot of planning conversation. We knew it was a need. But what we're seeing more and more is the level of the volume of people who are up in the Pleasant Hill area that don't have access to a lot of these basic needs supports. And that is something that is very, very new. It's not that we just didn't we're ignoring everything prior to COVID. It's that, through COVID and continuing on through this year and this summer, we are seeing a huge increase in the volume of people.
Yeah, I find your presentation very interesting in your research. I'm particularly studying restroom dignity and how designs can be improved, primarily focusing on increasing dignity and how that would affect user behavior rather than the typical approach that has been to go the route of like, I don't know, treating bathroom users like children. Like one particular case we examined was where like bathroom designers would remove mirrors from over top of sinks to like reduce the maintenance of like cleaning mirrors from water splashes and reduce the amount of time that people spent like looking at themselves or fixing their appearance in front of a sink or something like that. So I'm particularly looking at like, well, if we focused on improving the user experience, how would that change how users interact with these facilities? And it's really interesting hearing your side with like a bit more of like a historical like research background and knowing some of the origins of North American washrooms. And I was wondering if you found sort of any comments or findings on how like washroom infrastructure can be improved through your research beyond accessibility.
I know the one model that we've looked at a lot was in Edmonton and what the city of Edmonton did in partnership with Boyle Street, which I don't know if it speaks directly to user experience, but it definitely focuses more so on people feeling like a level of safety and engagement when they go to those washrooms and access those washrooms. And the other piece with that program was that like through Boyle Street, the attendants that were hired for those washrooms were people who were people accessing services at Boyle Street. So they weren't commissionaires, they weren't police, they weren't security, or uniformed people coming, to perpetuate this punitive approach that we have to solving issues. They were people from the community, they were people with living experience, and they, were employed through this program. So it became, beneficial in multiple ways, or created employment opportunities for people who are not usually offered employment, accessible employment that was understanding and designed in a way to support them, and then also made sure that the people who were, supervising or attending to these washrooms were people that were familiar to those that were accessing them, and made sure that they, it wasn't just about keeping the bathroom orderly or clean or preventing damage. It was about, connecting people to resources so they knew where to go, that they, could get directions to shelters and, whatever it may be. And that's a model that we've looked at a lot with accessibility, is that it is more so than just policing. And I think, I just know I can relate it to our drop-in experience. Like we employ people who hang out in the drop-in to help run our drop-in space. And it is the big reason why we don't actually deal with a lot of issues in our drop-in space. Because the people who access services then feel really safe and don't feel like they're pushed into doing certain things or behaving certain ways, that they're comfortable with the people that are around them and working with them, which then does change user experience and how they behave and interact in those spaces. Absolutely.
You had mentioned that the city was also looking at sort of funding current existing businesses that had washroom infrastructure. And I was curious if there were any sort of like requirements of a standard of a washroom that they'd be looking to fund if they were wanting to ensure that there were non-gendered washrooms or like single stalls or any sort of standards like that.
Yeah, I should be clear so the city folks don't freak out that we haven't actually asked yet. We will ask. It's one of the things that we will put on the roster of things that goes to the city. But when you talk about it, and when you look at like Edmonton's model, they sat down with the businesses in the corridor that was the hottest space, right? That had the most need, and said, so what are your concerns? And why don't you let people use the washrooms after hours? And what can we do to alleviate any of those pressures? And it really does boil down to resources in most situations, because it's about cleanliness, particularly during COVID now, it's particularly about cleaning, but also about repairs and other situations, right? And so the City of Edmonton with Boyle Street negotiated with a handful of businesses and said, you know, first of all, the washrooms needs to be accessible, all of them, so wheelchair accessible, mobility accessible. We've had conversations, and the City of Toronto as well has relationships around no gender on the washrooms. And you're starting to see particularly smaller businesses and restaurants that would have longer hours of opening having genderless bathrooms, right? Just having single washrooms that anyone can use that are wheelchair accessible. And so they looked at sort of a fleet of washrooms that were in that little corridor, and then offered an incentive to those businesses, a monetary incentive to those businesses to offset what they had claimed to be their highest reason to not have their washrooms open. So then they took that reason away. And so then the conversation was like, oh, okay, well now the reason is gone. So now we kind of have to open our washrooms. And so that's what happened. And they've had pretty decent luck with it. I mean, there's always going to be one-off case-by-case issues where washrooms are vandalized or something happens. And so they just need a mechanism to respond to that.
Something that we at least gave me more hope around engaging the business community as we looked at, and I'm going to cite or reference this totally wrong, and Colleen's going to, or Elizabeth might know, when we looked at what the Crohn Society had done to make sure that there was, you know, stickers in windows that said like, we're a Crohn safe washroom, like you can access our public washroom. And it was part of an initiative to help engage people, like Colleen was saying, back into the community, because there's so much fear around leaving the house with certain illnesses. And so there is mechanisms and models in place that other entities have used to engage the business community in similar things that we definitely, you know, can learn from and draw from and build on. The big barrier is always that somebody who is homeless and someone that's using substances is guaranteed to be treated way different and given different privileges than someone who is not. And so, you know, how do we build in education for businesses and awareness, make sure that the staff are properly trained to deal with whatever may come in, and build the capacity pieces so that people feel confident in their ability to, you know, offer resources to people who are homeless.
Mm-hmm. Yeah, so Elizabeth just dropped there's a Go Here app that Crohn's and Colitis has put together. It certainly is not an exhaustive list of washrooms in Saskatoon, but it's the ones that are connected to that group. It's on our to-do list as well. Yeah. Do you have any other questions?
Not a question, just a comment. When we're doing and looking at different spots for washrooms, we cannot forget the people that are in wheelchairs. Mm-hmm. So that's another thing we need to look at.
Yeah, so disability access has been high on the priority list, Colleen, to ensure that and particularly in the long-term conversations around new pieces of infrastructure, building washrooms, because you know the washroom at the public library is extreme. I don't even think the one in the basement's wheelchair accessible, if you can even figure out how to get down to it, right? And so, you know, when you're building a brand new public library, and they've done a ton of consultation around this to ensure that that washroom structure is accessible to every single person who might come through the door and need to get access to it. And so we've been trying to ensure that when we send our, hey, we're a public washroom advisory team, that they get that information as well. Yeah.
And if I could add, Colleen, that's a great comment. City has an accessibility action plan, And that includes, making sure we bring all new buildings, anytime we renovate an existing building, with those universal design standards, so it's universally accessible to everybody. So that's something that's a high priority for the city. So I just wanted to reinforce that.
Mhm. Yeah, thanks for that, Troy.
Yeah.
Johanna, I think I saw you unmute as Colleen was. Do you have something to share?
Well, I'm curious, Colleen. I recognize that the toileting aspects of this is extremely important, but for homeless people, being able to wash makes me curious about the temperature of water that's available. If washrooms are available and there's only cold water in them to wash your hands, that deters people from having full access to sanitation. And I'm thinking of mothers and children and homeless and women dealing with children and their needs, and the importance of having warm water to be able to wash properly. So I'm just curious about how that fits in.
Yeah, I mean, we've also had conversations around the long-term planning to include showers and laundry in this conversation, because there's one thing to wash your clothes in a sink. It's another thing to have actually laundry facilities and an ability to have a shower. And there are very few options in this city for any of that support as well. And so our early conversation is toilets and water. And then as we sort of emerge through the conversation, you're right, we flag things around warm water and the capacity to bathe and to be able to wash or to get access to other services. I know Kayla or anyone else want to add some pieces around the hot water piece.
Well, and I think the conversations that we're having and the way that we're continuing these conversations, again, is not that punitive approach that's often taken to deter people from accessing things or being there too long and that sort of stuff, which is where like cold water only facilities come in, is that it, deters people from doing certain things in facilities. That's not what we're looking at. We're looking at the opposite approach of how do we make this the best for the people that truly need the access to these resources, not what's most convenient for, everybody else.
And I think if we look at other urban centers who are doing public washrooms really well, you also see spaces for family washrooms. And in those family washrooms, you see better chairs for breastfeeding and better supports for parents who would require supports with their children. And those kind of things, even smaller toilets, right? Like low toilets for children, that kind of thing. And so when we're talking with, particularly in those long-term goals with agencies that are building new pieces of infrastructure, these are the types of things that we would also flag, right? Is building user-friendly spaces that encourage the use of them, as opposed to sort of be punitive and get you in and out as quick as possible and not make that experience what you would expect with affluence or wealth. Other folks, I did drop the general info survey in, right? So please tell us what you think about public washroom survey. We're actually plotting all that on, there's a postal code question. We're plotting it on a map to see, how different responses come from different areas in the city. You might not be aware that perhaps maybe there are different sections and different opinions in the city, depending on which section of the city you live in. And so we're quite interested to track some of those trends as well. So we would encourage you to take that little survey. It is anonymous except for your postal code, but we don't really know it's you. So, Colleen, did you have something else to share?
Yeah, just a note, and it might be out there, but when we used to go back to Batoche all the time, they brought in mobile showers and toilets and laundry facilities in trailers. They just brought it in, and that's how it worked. And they had everything that was needed there. So I don't know if you've ever, in your research so far, have come across any communities that have been doing that. Thank you.
Yeah, I laugh because Dan, you want to talk about portable washrooms? We've had this conversation so many times.
Yeah, we've looked at it. There are some pretty solid units out there now found that are reasonable. again, it comes down to the expense of maintaining, cleaning, and doing the security and and all that around them, and where you're going to put them. I mean, and then they really don't work well in the wintertime. So in wintertime, you've got to have heat and all of that. But there are sure units that you could drop into a parking lot that would have showers and washrooms and hot water and stuff like that. In the summer, I suppose they could probably winterize some of these, but then then our cost just keeps going up from that. So. But there are units out there, and that's a really good suggestion. I think we were looking at that this past summer. We just summer got away on us, so we didn't get it done. But we were looking at a couple of locations over at that 20th Street between the tracks and Avenue P area to maybe place some one or two of the units. So that might be a stopgap for next summer. So.
Yeah, winter kind of throws a monkey wrench into Saskatchewan planning as far as this type of, when there's water involved.
Yeah, winter and water turns out makes ice. So
I don't want to cut
see
it
that
short.
it's 1:30. You're going to come on. I was going to say.
I was going to say I don't want to cut the conversation short, and really, it's more up to if some folks wanted to stick around. But I think just to acknowledge that people's time, I do want to just officially sort of formally end the webinar and just thank everyone so much for coming. There's a second little evaluation feedback form in the chat. It really will take no more than 2 minutes, and really do value your feedback, both in terms of, future topic ideas, how can we improve these webinars and that sort of thing. So just really want to appreciate, thank you so much, Colleen, Kayla, and everyone from the Public Washrooms Advisory Committee for sharing this really, really important work that's happening in our community. It's just, yeah, I've learned so much today already, and a lot of gratitude to everyone for showing up here. And yeah, just wish everyone a really wonderful rest of the day and weekend.
I dropped my email into the chat as well. If you want to get involved, if you want a copy of the slide deck, that's also, I can give that to you too, Erin. I don't know if you want to share it on your website or whatever with the recording. But also, as we sort of emerge out of the planning at the advisory team into the actual operationalization of our goals, there will be lots of work to do. So the more the merrier. If you have a particular passion and you want to work on a short-term solution like a new temporary washroom for the summer, or you want to really talk about advocacy for long-term planning, or you come from like SHA and you know that you're building a brand new urgent care center and you might happen to be connected to that and you want to advocate from inside, that would also be welcome. So those kind of things, certainly just drop us an email and get connected to the work. Or maybe we missed something entirely and you want to say, what about this? That also works.
All right. Thanks everyone so much.